Hello to all my modern and unstoppable seniors tuning in right now. If you're in your 70s, 80s, or even 90s, and you're still curious about pleasure, touch, and staying connected to your body, this message is for you. There's something important we all need to talk about, and it's too often hidden behind embarrassment, shame, or just silence. What really happens to our sexual health and desires as we age? Before we dive in, drop the first letter of your name in the comments below and add a heart emoji. It's a simple way to bless your wellness journey and let us know you're here, walking this path with us in the Wellness for Modern Seniors community. Let's begin with the most fundamental truth. Your body is changing, and that's okay. It doesn't matter how healthy or vibrant you are. If you're human and you're aging, your body is going through changes. And those changes directly affect your sexual health. One of the biggest factors: hormones. From as early as your late 30s or 40s, testosterone levels begin to decline. And this continues steadily through your 60s, 70s, and 80s. Testosterone is a key hormone for things like libido, your desire for sex or intimacy, erectile function, mood and energy, confidence and motivation. When testosterone drops, many men notice a lower sex drive, more difficulty getting or maintaining erections, less intense orgasms, a longer recovery time between moments of intimacy. This is not a failure. It's simply your body adjusting to the new rhythm of age. Now, mix in other common age-related issues like reduced circulation or prostate changes. And it's no surprise that many older men start feeling disconnected from their sexual vitality. For women experience a similarly powerful shift. It's called menopause. It brings a dramatic drop in estrogen and progesterone. Estrogen keeps the vaginal walls elastic, moist, and sensitive. When it declines, women often experience vaginal dryness, thinner, less stretchy tissue, discomfort, or even pain during intimacy or masturbation. Reduced clitoral sensitivity, a decrease in spontaneous desire. It's not about losing interest. It's about biological changes that affect how intimacy feels and what your body needs to feel good again. These physical changes aren't just physical. They also touch your emotions, your sense of self, your confidence, your identity. You might ask yourself, is something wrong with me? Why doesn't this feel the same? Am I still desirable? Is it weird to still want this at my age? Let's be clear. There is nothing wrong with you. You are still whole. You are still human. You are still worthy of touch, pleasure, and connection, whether it's with a partner or with yourself. Circulation and muscle changes. What you might not realize, aging naturally leads to slower blood flow throughout the body. This includes your sexual organs. And since arousal depends on strong circulation, less blood flow can lead to slower arousal, weaker erections, less intense sensations or orgasms, more difficulty staying in the mood. Additionally, the muscles that support sexual function, like the pelvic floor, may weaken over time if not actively engaged. These include the muscles that help maintain erections, the muscles that enhance vaginal tightness and pleasure, the muscles that contract during orgasm. The good news? There are exercises and techniques, we'll explore those in later parts, that can strengthen these muscles, even in your 70s or 80s. Your journey is yours to embrace. There's no need to compare yourself to how you used to be. You're not trying to be 25 again. You're trying to understand, accept, and care for your body as it is right now. That is not giving up. That's deep wisdom. And that's what Wellness for Modern Seniors is all about. So if this message reminded you that you're not alone, and that aging doesn't mean the end of pleasure, give it a like. It's a small act, but it blesses this community and helps spread wellness to more modern and unstoppable seniors just like you. And if you haven't already, Subscribe and click the bell so you never miss a care tip tailored just for you. You're still growing, you're still learning, and your body still belongs to you. If you find this message helpful, please give this video a like. It's a small gesture that spreads wellness and helps reach more seniors who deserve to live their best lives. Understanding health risks. Why it's important to be careful as we age gracefully into our 70s, 80s, and beyond. Staying sexually active remains a healthy and joyful part of life for many seniors. However, it's also true that the body can become more vulnerable to certain health risks, and knowing about these risks helps us enjoy intimacy safely. Sexual activity, including masturbation, involves physical exertion, increased heart rate, blood pressure, muscle contractions, and sometimes even changes in breathing. For many seniors, especially those with chronic conditions, this can mean taking extra care. The heart connection. What seniors should watch for. One of the biggest concerns is heart health. Many seniors live with heart conditions like high blood pressure, coronary artery disease, arrhythmias, or past heart attacks, and sexual activity is a form of mild to moderate physical exertion. This means it can raise your heart rate and blood pressure, putting additional stress on your heart. That doesn't mean you must avoid sexual activity altogether. Far from it. Instead, you need to be aware of your limits and watch for warning signs. Warning signs to watch during or after sexual activity. If you notice any of these symptoms, it's important to stop and seek medical advice. Chest pain or tightness, dizziness or lightheadedness, shortness of breath beyond normal exertion, palpitations, irregular or rapid heartbeat, excessive fatigue or weakness. Experiencing any of these means your heart or body is sending you a clear message. Slow down, get checked, and discuss with your doctor how best to manage your sexual activity safely. Joint and muscle concerns. Protecting your body's movement. Another common health risk for older adults is joint pain or arthritis. Many seniors face stiffness, inflammation, or discomfort in joints like hips, knees, shoulders, or hands. Sexual activity or masturbation sometimes involves positions or repetitive movements that may aggravate joint pain or cause strain. Here are a few tips to protect your joints and enjoy intimacy more comfortably. Use supportive pillows or cushions to relieve pressure. Try positions that minimize bending or twisting. Take breaks when needed. Don't push through pain. Use gentle, slow movements rather than sudden or forceful ones. Comfort is key. Your body deserves gentle care. Medications and their impact on sexual health. Many seniors take medications daily for conditions like high blood pressure, diabetes, depression, or prostate issues. While these medicines help maintain your health, some can also affect sexual function, including lowered libido or interest in sex, difficulty achieving or maintaining erections, delayed or absent orgasms, vaginal dryness, or discomfort. You suspect your medication is interfering with your sexual health. Don't stop taking it on your own. Instead, talk openly with your healthcare provider. They may adjust your dosage or alternatives that work better for your intimacy and wellness. Balance and pacing. The secret to safe pleasure, knowing your body's current limits and pacing yourself, are two of the most important lessons in staying safe while enjoying intimacy. Here's how to balance pleasure with care. Take your time. Don't rush through intimacy or masturbation. Stay hydrated and rest as needed before and after. Use slow, intentional movements that don't strain your body. Keep communication open with partners or trusted friends about your needs. Listen carefully to your body's signals and honor what it tells you. This approach transforms sexual activity from a stressful event to a nourishing, joyful experience. You're not alone. Many seniors share these concerns. It's important to know that these concerns about heart health, joints, and medications are very common. You're not alone. By being aware and proactive, you empower yourself to Reduce risk of injury or discomfort. Maintain your independence and confidence. Enjoy intimacy without fear or shame. And that's what true wellness is all about. Living fully, safely, and happily. Don't forget, if you haven't yet, subscribe and click the bell so you never miss another care tip designed especially for you. Your body is a treasure. It deserves respect, care, and love at every age. Staying aware of your health risks is not about fear. It's about giving yourself the best chance to thrive. Why medications can affect sexual health in seniors as we age. Many of us rely on medications to manage long-term health conditions. These medicines play a vital role in keeping us healthy, active, and independent. However, it's important to understand that some medications can have unintended side effects that impact sexual desire, arousal, and satisfaction. This can feel frustrating, confusing, or even embarrassing. But know this, you're not alone, and there are ways to address these challenges. Common medications that may affect sexual function. Here are some types of medications commonly prescribed to seniors that might interfere with sexual health. Blood pressure medications, antihypertensives. Some drugs, like beta blockers and diuretics, can reduce blood flow and cause erectile difficulties or lower libido. Antidepressants, particularly selective serotonin reuptake inhibitors, SSRIs, can decrease sexual desire and make it harder to reach orgasm. Medications for prostate issues. Some treatments for benign prostatic hyperplasia, BPH, or prostate cancer can impact sexual function. Diabetes medications. While controlling blood sugar is crucial, some medications or diabetes itself can cause nerve or blood vessel damage affecting sexual response. Cholesterol-lowering drugs. Statins, while heart protective, may sometimes reduce libido or cause fatigue that lowers interest in sex. What to do if your medication is affecting your sexual health. If you notice changes in your sexual health after starting a new medication, it's important not to stop taking it on your own. Instead, consider these steps. Talk to your doctor openly and honestly. Your healthcare provider can help identify if your medications might be causing side effects. Ask about alternatives or dosage adjustments. Sometimes switching to a different drug or lowering the dose can improve sexual function. Explore additional therapies. Your doctor may suggest medications or treatments to help counteract sexual side effects. Consider non-medical approaches. Counseling, pelvic floor exercises, or lifestyle changes might boost your sexual wellness alongside medication management. Managing expectations and embracing new realities. It's natural to feel frustrated if medication impacts your sexual experiences. But it's also an opportunity to explore new ways of connecting, feeling pleasure, and expressing intimacy that may differ from your past experiences. Sometimes, this means focusing more on emotional closeness, sensual touch, or different kinds of stimulation that feel good and safe. Supporting your sexual health beyond medications. Besides working with your doctor, there are many supportive habits that can help maintain or improve your sexual wellness. Stay active. Gentle exercises. Improve circulation, stamina, and mood. Eat a balanced diet. Nutrient-rich foods support hormone balance and energy levels. Prioritize sleep. Quality rest is essential for sexual desire and overall well-being. Manage stress. Mindfulness, meditation, or relaxation techniques help keep your mind and body balanced. Communicate. Share your feelings and concerns with your partner or a trusted friend. Connection matters deeply. Remember, your sexual wellness is part of your whole wellness. Sexual health is not just about physical function. It's tied to your emotional and mental well-being. Feeling valued, desired, and comfortable with your body is part of living fully as a modern and unstoppable senior. If medication challenges have been weighing on you, Know that you are not defined by them. You have the power to advocate for yourself and seek solutions. And if you're new here, don't forget to subscribe and hit the bell icon so you never miss a tailored care tip designed just for you. Your health journey includes your sexual wellness, and that's something worth celebrating and protecting every day. Why emotional health and intimacy matter more than ever as we journey through our 70s, 80s, and beyond. Emotional well-being and intimacy take center stage in our quality of life. Sexual health isn't just physical. It's deeply intertwined with how we feel about ourselves, our relationships, and our connection to others. Many seniors face challenges here, including feelings of loneliness or isolation, loss of a partner, or changes in relationship, dynamic shifts in self-esteem or body image, societal stigma around aging and sexuality. These factors can affect not only desire, but also how meaningful intimacy feels. Healing the heart to support sexual wellness. The emotional side of intimacy requires kindness and patience, especially with ourselves. If you're navigating loss, changes in relationships, or new experiences with dating, it's normal to have mixed emotions. Here's how you can nurture emotional well-being to support intimacy. Practice self-compassion. Speak gently to yourself and honor your feelings without judgment. Reach out. Connect with friends, support groups, or counselors who understand the unique challenges seniors face. Express your needs. Open communication with your partner or loved ones builds trust and closeness. Explore new forms of intimacy. Intimacy isn't just sex. It can be cuddling, holding hands, deep conversations, or shared laughter. Rekindling connection after years together for couples. Aging can bring changes in sexual routines and desires. This is a time to explore together, learn what feels good now, and adapt with curiosity. Try these approaches to keep your connection vibrant. Schedule time for intimacy. Life gets busy, but setting aside moments to be close is a gift. Focus on sensuality. Slow down and savor touch, smell, sound, and taste. All senses can deepen pleasure. Be playful. Humor and lightness can remove pressure and invite joy. Seek help if needed. Therapists specializing in senior intimacy can offer valuable tools and insights. Dealing with emotional challenges, it's common to feel frustration, grief, or embarrassment about changes in sexual health or desire. Sometimes, these feelings can cause withdrawal or reduce self-confidence. Here's how to manage these emotions. Acknowledge your feelings. Suppressing emotions only adds to stress. Writing in a journal or talking with someone trusted can help. Challenge negative self-talk. Replace harsh judgments with affirmations like, "I deserve pleasure and connection." Set realistic expectations. Aging brings shifts. Accepting them frees you to find new joys without pressure. Practice mindfulness. Being present in your body and moment helps ease anxiety around intimacy. Embracing intimacy in all its forms. Intimacy isn't a one-size-fits-all concept. For many seniors, it evolves into deeper emotional closeness and shared experiences. Whether single, partnered, or somewhere in between, intimacy might look like spending quiet, meaningful time with loved ones, engaging in hobbies or activities that bring joy and connection, exploring gentle touch or massage, cultivating friendship and trust, the mind-body connection. Remember, emotional well-being and physical pleasure are connected. Stress, anxiety, or depression can lower sexual desire and enjoyment, but improving your mental health can help revive it. Consider gentle exercise like walking or yoga meditation, or deep breathing techniques, creative outlets such as art or music, supportive counseling, or therapy. Share your story. If something here speaks to your heart, please like this video and share your thoughts or experiences in the comments. Your voice matters. Your story could inspire and support another modern and unstoppable senior walking this path. if you haven't already. Subscribe and click the bell icon so you never miss a care tip designed just for you. Your emotional wellness and intimacy are vital parts of your full, rich life, and here at Wellness for Modern Seniors, we're committed to helping you thrive. Why safe pleasure matters more than ever as we age. Enjoying sexual pleasure remains an important part of well-being, but it's essential to approach it safely and thoughtfully. Changes in the body, health conditions, and medications mean that what worked before may need adjustment. That's completely normal. Pleasuring yourself or with a partner should feel good, not risky or uncomfortable. Choosing the right lubricants and products. One of the most common issues seniors face during sexual activity is dryness or sensitivity. Using the right products can make a huge difference in comfort and pleasure. Water-based lubricants are usually the safest choice. They're gentle, easy to clean, and compatible with most toys and condoms. Avoid scented or flavored lubricants, which can irritate sensitive skin. Silicone-based lubricants last longer but may not be compatible with some silicone toys. Use with care. If vaginal dryness is persistent, talk to your healthcare provider about safe options including vaginal moisturizers or hormone treatments. Gentle movements and positions. Older bodies may require modifications for comfort and safety during sexual activity or masturbation. Consider these tips. Move slowly and listen to your body's signals. Discomfort is a sign to adjust or pause. Use supportive pillows or cushions to ease pressure on joints or muscles. Experiment with positions that reduce strain. Lying on your side or sitting may be more comfortable than standing or kneeling. Take breaks as needed and focus on the journey, not just the destination. Hygiene and care. Maintaining cleanliness is key to preventing infections, especially with age-related changes in skin and mucous membranes. Wash hands and any toys or objects used thoroughly before and after use. Use mild, fragrance-free soap to avoid irritation. For those with catheters or other medical devices, follow your healthcare provider's instructions carefully to avoid complications. Communicating boundaries and comfort. Whether you're pleasuring yourself or with a partner, clear communication about what feels good, what doesn't, and what you want to try is essential. Don't hesitate to say yes, no, or let's try something different. Use positive language to encourage exploration and mutual respect. Remember, consent and comfort are foundational to enjoyable intimacy at any age. Avoiding common risks. Some activities or habits can increase the risk of injury or health problems. Avoid vigorous or repetitive motions that cause pain or soreness. Be cautious with toys or objects. Make sure they're designed for sexual use, body safe, and properly cleaned. If you experience any unusual pain, bleeding, or discomfort during or after sexual activity, contact your healthcare provider. Mindfulness and presence, focusing on the present moment during sexual activity, can deepen pleasure and reduce anxiety or distracting thoughts. Use deep breathing to relax muscles and center your awareness. Pay attention to sensations, sounds, and feelings without judgment. Embrace curiosity and playfulness. Pleasure is about exploration, not perfection. When to seek professional support. If you're struggling with sexual discomfort, pain, or emotional challenges related to intimacy, know that help is available. Sexual health therapists, counselors, and geriatric specialists can provide guidance tailored to your unique needs. Don't hesitate to bring up sexual health during your medical appointments. It's an important part of overall wellness. And if you haven't yet, subscribe and click the bell to get the next empowering care tips tailored just for you. Your pleasure and safety matter. Honor your body. Embrace your desires and explore with confidence. You are not alone. This is a normal part of aging first. Remember, your experiences, feelings, and questions about sexual health are completely normal. Aging brings changes, yes, but it doesn't mean your sexuality or pleasure disappears. It simply evolves. Whether it's changes in hormone levels, physical shifts, or emotional challenges, all these aspects are part of your unique story. And each story deserves respect, compassion, and care. Take charge of your sexual wellness. Empowerment comes from knowledge and action. You've learned about physical changes, health risks, medications, emotional well-being, and safe ways to enjoy pleasure. Now, it's time to take that knowledge and put it into practice. Be proactive. Talk openly with your healthcare providers about any concerns or questions. Explore. Be curious about new ways to experience intimacy and pleasure. Adapt. Listen to your body and adjust your habits for comfort and joy. Communicate. Share your feelings and desires honestly with your partner or support network. Celebrate. Your sexuality, at any age, sexuality isn't just about sex. It's about connection, love, self-expression, and joy. It's about feeling alive in your body and celebrating your unique essence. Many seniors find new dimensions of intimacy and pleasure they never expected. Deep emotional bonds, playful experimentation, or simply the peace of feeling comfortable in their skin. Support each other. The Wellness for Modern Seniors community is here to support, uplift, and empower you. Your stories, questions, and insights create a rich tapestry of shared wisdom. By engaging, commenting, and sharing, you help others feel seen and encouraged. Stay connected with us if you haven't already. Please subscribe and click the bell icon so you don't miss our upcoming videos packed with health tips, wellness, advice, and encouragement tailored just for you. A final blessing for your journey. Your body, mind, and heart deserve love, care, and respect every day, in every season of life. Embrace your sexuality and intimacy with openness and courage. Remember, your pleasure and well-being are vital parts of your whole self. Thank you for trusting Wellness for Modern Seniors as your guide on this important path. You are modern, unstoppable, and deserving of every joy life offers. If this message has touched your heart, please like it and share with your fellow seniors. Your wellness journey inspires us all.